and welcome to Deuk Spine and Joint Institute. I'm Dr. Deuk Majin, CEO and founder of the Deuk Spine Institute and Deuk Joint Institute. Our patient here is one who travels from Virginia, West Virginia specifically. She's had numerous fusions done in her spine, which you can see on the x-ray view. Are you on the x-ray view?
Yeah.
And you can see there's lots of metal. There's screws in the L5S1 pedicles, bilateral with a crosslink and top-loading rods. Just below that is the what are called cages that are put across the SI joint. She had a surgeon do a double SI joint fusion on her, and she still has sacroiliac joint pain. So she came in, we evaluated her, we figured out she's having pain from the L4-5 disc, and she's also having pain from her bilateral sacroiliac joints as well as her facet joints. So we're going to be performing a Deuk plasma rhizotomy with Dr. Bharat Patel, who's the head of our interventional program here at Deuk Spine Institute. He will be treating both sacroiliac joints with a Deuk plasma rhizotomy. Now, during this procedure, we use X-ray to guide us. We use the front-back view called an AP view, and Dr. Patel will use his probe. You can see it at the top of the screen, right next to the pedicle screw of S1, right there. Yep, right where the arrow is pointing. Thank you, Jordan. Or is that Sanjay? That's Sanjay. Are they able to see that, your arrow? No. Yes, but you got it. All right. So Dr. Patel is going in, and the first thing he's going to do is burn the dorsal ramus of L5, which innervates the top of the SI joint. And then he's going to work his way down. You can see now he's already moving down to the first foramen, and he's going to burn the nerve as it goes out laterally and innervates the SI joint. Once that nerve is destroyed, he'll move down in a sequential fashion. There are 5 nerves that he has to destroy. All of them move from medial to lateral, leaving the dorsal sacral foramen, S1, S2, S3, S4, traveling laterally over to the sacroiliac joint, which you can see has hardware across the joint, which was put in by a surgeon in Virginia. And I will tell you, I have seen an explosion of sacroiliac joint fusions out there. We do not perform them at Deuk Spine Institute. It's totally unnecessary procedure. Patients do not need sacroiliac joint fusions. It is a procedure that shouldn't be performed, and what should be performed instead is the sacroiliac joint Deuk plasma rhizotomy done here at Deuk Spine Institute, Deuk Joint Institute. But nonetheless, someone got to her before we could, and we could stop them, and unfortunately now she's living with all this metal in her lower back that's not really helping her. The good news is she's here, and we are going to fix her pain. Dr. Patel is going to move down the sacrum, one side then the next. You can see the probe. There it is. Another x-ray has been taken. I don't know if you can hear me, Jordan, but maybe if you can use your little white arrow to point out, thank you, Jordan, to point out the probe. Excellent. Good job, Jordan. This is a procedure that uses X-ray to guide the surgeon. We call it X-ray image guidance. And you use the X-ray for 2 purposes in the surgery. One is localization, to find your target. The second is navigation, to navigate to the target. And right now, Dr. Patel is using these AP X-rays of the sacrum for both purposes, localization and navigation. He's localizing the holes where the nerves come out the back of the sacrum. Then he's navigating his instrument to those areas. We call it colocalization, where you put an instrument in the same place as you have something you want treated. In this case, the dorsal rami, the dorsal nerves. And of course, he's going to deliver a powerful burst of energy, which is going to kill those pain nerves. By destroying these pain nerves, it interrupts the flow of pain signals from the sacroiliac joint up to the brain. It's quite a simple process. As a matter of fact, it's exactly what the spinal cord stimulator tries to do. The spinal cord stimulator tries to short circuit the pain signals from reaching the brain. They put these electrodes over the spinal cord and on the back of the spinal cord, and they put these contact points over the dura or covering, and the generator will then send electrical signals from one contact point to another, and it'll create this magnetic field, basically, that interferes with the transmission of electrical signals up the spinal cord in the posterolateral columns, which transmit pain information from the body up to the brain. So by disrupting the transmission of pain signals along the spinal cord, the idea is that you reduce the amount of pain that reaches the conscious levels of the brain. Therefore, the patient has subconscious pain, but not conscious pain that they're aware of. Anyway, what we're doing here is far better. It's more accurate, more precise. There's no implant needed, and it's safer for the patients, better for the patients long term to not have a piece of metal in their spine or in their body. All right, looks like Dr. Patel and Dr. Davis are moving to the opposite side. I'm sure Dr. Davis is impressed with all the hardware in this patient. Being an orthopedic surgeon, he's seen lots of hardware in his career. I want to maintain a level of professionalism, but those sacroiliac joint pins, cages, they look like giant metal. Use your imagination. Dr. Patel is now working his way down. It looks like the patient's right side of their sacrum, deadening the pain nerves as he moves down. And we've been doing this procedure now for over a year here at Deuk Spine Institute, and we've had incredible success. I don't think we've had a single failure from any patients. Every one of them, we've gotten rid of the sacroiliac joint pain. There is a side effect of numbness in the back of the skin behind the sacroiliac joint. That usually takes about 6 months to a year to come back. Some patients will have a sunburn feeling. The sunburn feeling goes away after a few weeks, is what I learned from Dr. Patel. Looks like we're just about done. Jordan, why don't you show us the bottom of the SI joint over there? Thank you. That's it right there. You can see the white arrow. He's pointing. There's two lines running up towards the screws. And, yep, there it is. That's the SI joint. And you can see Dr. Patel's probe is burning the nerves as they leave the sacral foramen, dorsal foramen, and head over to those, head over there. Okay. Very good. We're going to wrap this up. This is a Deuk plasma rhizotomy, bilateral sacroiliac joint in a patient from West Virginia who traveled here because she's having horrible pain. And she's already had a bilateral sacroiliac joint fusion, which didn't work. Had a spinal cord stimulator, which didn't work. Had a fusion at L5S1, which didn't work. So hopefully we'll send her home for this holiday season with pain-free. That's our goal.